All right, so let's kind of get into digging into stem cell therapy. So tonight, basically, for those for if you don't know who I am, my name is Dr. Chris Cox. I'm a chiropractor here at Life Aligned Wellness Center. So I'm part of the integrated medical team here. And I work with another chiropractor, an amazing team, and our nurse practitioner who handles all of the stem cell therapy injections and analysis and all that kind of stuff. So love being a part of this. My own personal story relative to kind of stem cell therapy is I've been a lifelong athlete. And with that, for most people kind of get that comes with injury. So for most people, athletics is not a matter of if a person is going to get injured, but more or less when. And so that is my story, from knees and low back and all kinds of shoulders and all that kind of stuff. So I've had those issues over the years, and lots of ups and downs, so like I said, injury and recovery, from torn meniscuses to ruptured Achilles tendon and all kinds of different stuff. But including I've been 70 to 80 pounds heavier than I am now. So I bring that up just from a perspective of, I know I have a lot of reality on some of the health challenges that people experience. So not only just a lot of empathy working with people or compassion, but experience. I know what it's like firsthand to have to recover and go through some of these things. So that really brings, I find, a different perspective at working with people and helping them regain lost quality of life. So I've been practicing healthcare for about 25 years with patients literally every day. So I love working with people. I love to see the possibilities open up and the regaining of lost health and lost hope is kind of what it boils down to. So sometimes when we meet with people, we see that people have had a vision for what their future looks like, and they've just kind of given up the idea that that's going to happen, and seeing that actually change, and those doors that they thought were closed actually reopen again, and that potential really kind of becomes a reality. So my personal purpose is unlocking human potential. And it's part of how I connect with what we do in the stem cell therapy or regenerative medicine side of what we do, is I do truly believe that we all have amazing gifts that we have an opportunity to fully express while we're on this planet. And I know that it is difficult for us to live to our greatest life when our health is not allowing us to do that. So if there are things that I can do to help someone's health get better or regain that lost health so they can be the best version of themselves, I'm in. And that's something that I love to do and be a part of for people. So so that's kind of a little bit about me. As we kind of talk about where I want to go tonight. So the first thing is that I just want to thank you for being here and taking this time to spend with me, to go through this information and learn something. So I'm really thankful that you've decided to join me here tonight. I want to thank you for your time. I think that time is the great equalizer. If you examine how somebody spends the 24 hours they're given in their day, I can tell you what their priorities are. So the fact that you're here and not somewhere else doing something else tells me that you prioritize your health. So I want to acknowledge you for that. I think in this age, especially right now, it's become abundantly clear that our health is our greatest resource, and that when that health is threatened or compromised in any way, it really does affect everything else in our life. So thank you for your time and being willing to invest in yourself and gain some knowledge about how something that we do here at the office might be able to impact your quality of life. Tonight specifically, we're going to talk about regenerative stem cell therapy. So there's lots of things to talk about. There's lots of confusion out there. So we're going to talk about what stem cells are. We're going to talk about what they do, the different types of cells that are actually available, and then really just kind of ask, are stem cells a great choice for you or not? And then you'll also have a very special opportunity to take advantage of at the end of tonight to come in and all that kind of stuff. So I'll talk about that at the end. So we'll get to that later. All right, so the first question is, what are stem cells? And basically, they're regenerative cells that facilitate growth and repair in whatever cell type your body needs in order to replace or repair damaged tissues. So basically, stem cells create an environment that causes your body to regenerate damaged tissue, right? So these are cells you've always had, and that's why it's considered a natural therapy, because the stem cell therapy and those cells and what they do, you've always had them, right? Now, the difference and why they're so important as we age, excuse me, is those stem cells when we're younger are in much higher concentrations, and they're actually more effective when we're younger. Right? When you think about it, picture, 4 or 5 or 6 or 8-year-old on a playground. How many times do they fall down and bounce right back up? And then they do that the next day and the following day and the day after that. And they just heal and repair and recover. I mean, if you put any one of us, me included, through a day of a 5-year-old, I'm not sure I'd get out of bed the next day. Right? So part of the reason these young kids heal so rapidly is because of stem cell concentration and effectiveness. Now, what's interesting though regarding stem cells is that there are as of today, about 4,500 studies currently being conducted worldwide on stem cell therapy. And I think it's important to understand the reason why that's happening is because stem cell therapy, in my opinion, has the opportunity to change the face of healthcare. What we know is that your body can regenerate damaged tissue in a very effective, efficient way, in ways that it did when you were much younger with stem cell therapy. Well, if that can happen, what does that do to the need for drugs and surgery? Well, it significantly changes that. So today's medicine is very, very dependent upon drugs and surgery as the choice to manage pain of chronic degenerative changes. So when we have a natural therapy that's simple, safe, and effective, well, we're starting to check all the boxes of how to really change the course of a person's quality of life in a very easy way. Now, what's not being studied in those studies is what stem cells actually do. Like, we actually know what they do. Most of the studies are actually being centered around how to best utilize stem cells to generate the outcome. So it's basically on application. So there's lots of amazing things that are being studied in stem cell therapy, almost everything you can think of relative to disease processes within the body. Now, what do stem cells actually do? Well, what they do is they actually seek out damaged and degenerated tissue via the inflammatory response. So in essence, when your body breaks down, right, when the joint or the cartilage or whatever cell or tissue is breaking down, it sends out a little chemical signal. And those stem cells kind of hear that chemical signal and they migrate towards that area of damage or degenerated tissue or that process that's occurring. And they do that via the inflammatory response that our body naturally generates. Excuse me. And what they do is they produce what I like to refer to as a fertilizer for cell regenerative and repair. Now, technically it's called a matrix, but I think fertilizer is a better term, because the analogy I like to use is one that I remember back when I was a kid. I grew up in Minnesota, and the dirt there is really, really, really black, and outside of every field is outlined with green, right? And you don't have to water anything because it just grows. And what I envision is a farmer standing out there, and he's spreading all this fertilizer all over the field. And then you've got to water the field for a day or two, and then you got to let the sun shine, and then what grows in the field? Well, what grows in the field is whatever's there, right? So it could be weeds, it could be corn, it could be soybeans from last season or something like that. But in essence, that's what stem cell therapy actually does. The stem cells themselves don't actually turn into you, or generate your tissue. What they actually do is they produce this fertilizer, they produce this matrix that causes your own cells to regenerate the damaged or degenerated tissues. So they're the facilitator of this process. So it's an important distinction to understand how that really works. Now, because of that regenerative process, they're also anti-inflammatory. So when the tissues are healing, well, the inflammatory response goes away, right? Because the cells are actually regenerating. Now, one key distinction to understand is that stem cell therapy does not actually treat anything, right? What stem cell does is it simply reignites your body's natural healing ability that's always been there, right? This innate ability to restore and replenish and regenerate. That's what it does. So think of it like a car that's run out of gas, right? Well, what you don't do with a car that runs out of gas is you don't like replace the engine, right? You don't paint the car. You know, what you do is you get some gas, you put it in the tank, and then you turn the key and you drive off again. Well, that's kind of what stem cell therapy is like. It's reigniting, replenishing those stores of that fertilizer, those cells that make that fertilizer or that matrix, so that your body can regenerate. So really important distinction, because the stem cells themselves will generate that matrix, which can cause any type of cell in your body to regenerate. So it doesn't matter whether we're talking brain cells or heart cells or cartilage cells or bone cells or tendon cells or ligament cells, it doesn't matter, right? Stem cell therapy will will facilitate your body to regenerate any type of tissue. So pretty amazing. Now, there's different types of cells available, and this is really critical, because one of the biggest confusions that I see out there today is people are unaware that there are different types of stem cell therapy, right? So just because it says stem cell therapy or I got stem cell therapy doesn't mean they actually got the stuff that works the best. So basically, stem cell therapy has been around for about 40 years. And when that started, it started with an embryonic or fetal type of cell through abortion. Now, that type of stem cell that was generated 40 years ago, over 40 years ago now, is illegal. You cannot use that type of cell. So so that's not even an option, right? So the other three types, which is amniotic, placental, and autologous cells, have all been around for 40 years. So now, amniotic and placental cells obviously are from the placenta, the amniotic fluid, after a mother delivers the baby. And autologous cells are actually harvested from you, right? So they actually do a surgery where they extract bone marrow from one of your bones, like most often your hip, or they'll take out some fat tissue, and then they utilize that. They basically extract the stem cells and then re-inject them in a different area. So what we've found is that those three types of cells, on average, are about 18 to 20% effective. So the problem with this is that if you went into majority of the orthopedic offices out there today, you would find stem cell therapy on the list of services available. And more often than not, it's going to be one of these three types of cell therapies. Now, it doesn't mean that they don't work. It just means they're less likely to work. Now, the reason being, mainly for the autologous cells, is because those cells are coming from you, meaning they're older cells, right? So they're not as effective at producing fertilizer. And we don't actually know how many stem cells we're actually putting in, right? We can extract marrow, we can extract fat cells, but we don't count those cells. We don't know if there's even any going in, right? So it could be nothing midday. So it's not as predictable as the last type, which we'll talk about in a minute. Amniotic and placental therapy is an acellular therapy. So it doesn't have any live cells. All it has is a big shot of fertilizer. So sometimes amniotic and placental therapy can be helpful for mild degenerative changes and stuff like that. So, but still, overall, those three types are on average about 18 to 20% effective. Now, the last one is where all the massive research is being done, and that's the type that generates a different level of effectiveness. So about 8 years ago, the laws changed, and we're now able to utilize a donated umbilical cord tissue or cord blood from a donation after birth. So basically what happens now is mothers that are pregnant are asked, what do you want to do with the umbilical cord tissue or blood? And basically there's three options. They can either pay to bank those cells themselves, which is, you know, thousands of dollars, because it's expensive to extract them and freeze them and store them and all that for some later date of utilization. They can have those cells destroyed, or those cells can be donated, right? Well, if donation is chosen, well, then the mother is tested for a whole host of genetic disorders and all that kind of stuff, anything that would make the cells not viable or not safe for someone else to use. Well, fast forward a couple months after the child is born, the mother is asked immediately again, what do you want to do? So the choice again is either bank them themselves, have them destroyed, or donate it. If donation is chosen, then the mother is tested again, the cells are tested, and the baby is tested. If any of those tests come back positive for anything, those cells are immediately destroyed. So these cells are donated from full-term, live, healthy babies and mothers that have chosen to donate those cells. So the same level of testing that goes into organ donation to make an organ safe to be transplanted is the same level of testing that umbilical cord tissue and cell tissue and blood gets tested by. So now, the reason they're so effective is because we know the maturity, reading, those cells are donated, harvested, and frozen within 24 hours. So we know that those cells are as effective at producing that matrix or that fertilizer as they can possibly be. And we know the concentration level. So we know how many cells we're actually injecting because we can count them. So by being able to guarantee maturity and guarantee concentration, we know we're getting the best and the most productive cells available, which makes them between 80 and 90% effective. So that is a significant change from the 18 to 20%, which we've had for 40 years, to the last 8 years, we've been able to use cells that are 80 to 90% effective. Now, here's the catch, is that many people we've heard will say, hey, I had stem cell therapy, or my brother had stem cell therapy and it didn't work. Well, what's the first question you think I might ask? Well, what kind of cell therapy did they actually receive? And the look on their face 9 out of 10 times is completely blank. They have no idea that there's more than one type of stem cell therapy available. So the key is all the results that have shown dramatic improvements are generated around the donated umbilical cord tissue or blood. So it has been shown and widely known to be the most effective type of stem cell therapy. So that's the one we primarily use in our office. Now, so some of the frequently asked questions, you know, is it safe? It's as safe as donating blood, right? So it's anytime someone would pierce the skin, like I said, through a blood draw, it carries the same risk. So if with the organization that I work with, colleagues, we've injected over 15,000 people without a single adverse reaction. So it's incredibly safe. In fact, significantly more safe than drugs and surgery. How much does it cost is a great question. And it really depends on the particular person, and it depends on, pardon me, a lot of different things. The first thing it depends upon is how many different areas are we working on, right? Are we working on just a knee, or are we doing both knees, both hips, and a shoulder? Well, obviously, it's a lot more to work on 5 joints than it is to work on 1. The next thing that determines the cost is the state of the joints. You know, are those joints mildly degenerative, like we're on the very front end of this degenerative process, or are we on the tail end, like these joints are really, really bad? And if that's the case, then that requires a lot more stem cells to generate an improvement. And then the last variable is the health of the person. You know, someone who's relatively healthy, who, you know, eats a good diet and all of those types of things, is more than likely doesn't take as much stem cell, as many stem cells as a person who's really suffering a lot of chronic health issues or inflammatory processes. So stem cell therapy can be as little as 1,500, and it could be over 8,000 or 9,000, right? Depending on the amount of cells, the number of joints, the health of the person. So all those are variables. When we do our consultations with our nurse practitioner or our patients, that's part of the recommendations that we'll sort out your specific needs and then what recommendation. How long does treatment take? An average treatment takes anywhere between 10 and 30 minutes, depending on, again, the number of sites that we're injecting. Most people drive themselves to the appointment and then drive themselves home. It's very non-invasive, and most people describe it as very, very easy and much easier than they thought it was going to be. So it's a rather enjoyable process. Most people have come away, thought it was going to be much worse than it was. How many treatments are needed? For 80 to 90% of the people we work with, just one treatment is necessary. So the key is getting enough cells into the joint in the first place. For the 10 or 20% that require an additional treatment, that's part of the things we talk about up front. So those are things that we would have some indication that might be necessary down the road. Side effects, there really are no side effects. The only thing people talk about sometimes is that because the stem cells are drawn to inflammation, often we're recommending people stop taking anti-inflammatory type medications or supplements. And when you take those away, that joint's going to get inflamed. And when it gets more inflamed, it becomes more painful. So sometimes the injection process to make sure that some stem cells are most effective, sometimes that joint gets more painful during that process of injecting. And then as the stem cells start to work and do their thing, then the joint starts to feel better and better. So I'm not sure that's really a side effect, but it's one of the things to expect as we go through the stem cell therapy process. How soon will you see results? Most people see results in about 6 to 8 weeks is where those results start to show up. The main reason is those stem cells get injected. They start producing their fertilizer right away. And we also know that those stem cells will replicate every 28 hours. So one cell turns to 2, 2 to 4, 4 to 8, 8 to 16, and so on and so forth. And they make that duplication process every 28 hours. So over the course of 6 to 8 weeks, the number of stem cells that are producing that fertilizer, that matrix, is exponentially growing, getting greater and greater and greater. So you think about the amount of matrix that's actually being produced. It just takes a little while to build that up in the system, and it takes a while to kind of trigger that regenerative restorative process that your body will create. So is stem cell therapy a good choice for you? The best kind of answer at this point is it really depends. You know, so the question I always ask people, what's at stake for you? You know, so living a life that's inactive and not up to what's possible for you, what are you missing out on? You know, is it walks with your grandkids? Is it travel? Is it, peace of mind that you can stay active? Is it your mood, right? Chronic pain, can really be very, very stressful and depressing. So, what's at stake? What's it costing you to not do something about it? And what we know at this point, that with degenerative changes in your joints, you really only have a few choices, right? So the first option really just to suck it up and tough it out, right? And just not do anything. And obviously that's an option. That's what some people have done up to this point. But also, it kind of leaves us stuck where we are, right? So often the first step for people is drugs. And that often starts with over-the-counter stuff, and then it becomes prescription. And ultimately, we start to see people start taking opioids, which we know the damage that does to our body, the addictive nature of those medications. And what ends up happening is it actually causes a greater deterioration of our health, and therefore reduces our quality of life. So we know that a lot of times drugs are not a great option. And the side effects are pretty terrible. So, so if drugs are are not great. Surgery is even worse, right? The risks that are associated with surgery are significant, not to mention months and months, and sometimes up to a year of rehab, especially if we're talking about shoulders. So surgery becomes one of those things that there's a lot of risks, and sometimes the outcome isn't all that great, that it's not as good as we had hoped. And this is where stem cell therapy kind of comes into the equation of a therapy that is non-invasive, very low risk, is effective when applied appropriately, and can generate a wonderful outcome for people. So when people really value non-invasive treatments first, right? That we all know people that are like, oh, there's a new surgery, I'll take that. Sign me up for the new surgery, right? If that's you, I'm not sure stem cell therapy is the right choice. But if you prefer to deal with things in as least invasive way as possible first, stem cell therapy is a great option. If you prefer natural therapies before the risk of drugs and surgery, well, then stem cell therapy might be a good choice for you. And if you like the idea of virtually no downtime, right, that you don't have to spend, weeks recovering from a surgery and then months recovering in physical therapy, stem cell therapy is a much different process. So is it a good choice for you? Well, that's kind of where the special opportunity comes in tonight. So what we've kind of talked about is really kind of what's possible with stem cell therapy, and so much of it is really centered around regaining lost hope of a better quality of life, that we've seen degenerative change occur in our lives, and we know there's a possibility for the body to actually regenerate itself and to do so naturally and safely. So we've really talked about what stem cells are, what do they do, the different types that are available, and why that's important to know up front, what type of cells are we utilizing. And then we've talked about maybe some of the things you want to consider if stem cells are a good choice for you. So, now given kind of that we've gone through a lot of this, you can see why maybe it makes sense to find out, are you a good candidate for stem cell therapy, and what does it actually take, right? So with that in mind, the special opportunity that you have is actually a comprehensive stem cell therapy consultation that includes all your follow-up care if you choose to proceed. Now, the 1 hour consultation is going to be with our nurse practitioner. They're going to answer any and all of your additional questions regarding stem cell therapy. We're going to talk about kind of what category does your situation fit in. Are you a sure thing, so to speak, or are we barking up the wrong tree? Or is this one of those like, well, we're not really sure. We want to know that up front so that you know what to expect. We'll talk about application and dosage and costs, scheduling your injection and timeline and all that kind of stuff, what you need to do to prepare. We'll outline this whole process for you, which will also involve a detailed history and examination of the areas that you're seeking solutions for. So basically it covers everything, including all of the follow-up care, which can be up to 8 to 9 months worth of follow-up care. Now, normally, the gift was $199. So the cost for that we normally charge is $199. And we all know that procrastination is the thief of health. If I hear this almost every day with patients, in that if I had known that this was the outcome a decade ago or 20 or 30 years ago, I would have done things different, right? So the key with especially stem cell therapy, the faster you get those cells in there, the better outcome that you get. Another day that a chronic problem exists, it becomes closer to being permanent. So my advice, don't wait. You have to get on this stuff pretty quick. So if you're ready to start this journey and really to take kind of the next step is to actually schedule a one-on-one, or what we can do now is a virtual consultation with our nurse practitioner. So because of the needs in our community, we've decided to make these virtual consultations available. We've had a number of people go through them already, and they love them. Really simple. We can get majority of the information we need for most of the people. Sometimes we have to follow that up with an in-person examination. But our nurse practitioner will make that determination. And if that's necessary, the the cost will cover that appointment as well. So, like I said, we're going to go through a complete health history with our nurse practitioner, the condition-specific exam of your affected area. Then we're going to be able to make your custom recommendations to meet your goals and what you need to do to increase the probability and leverage your actions so that you can get the best results possible. So all of that will be laid out as far as how to make sure we do that. Now, as I said, normally it's $199 for that appointment and all those visits and all that kind of stuff, which is still an amazing deal. However, tonight only, we're actually going to do it at no charge. So it's everything that we did. There's no catches or anything like that. It's if you schedule your appointment tonight, we'll do your consultation either in person or virtual at no charge. Now, here's how you take advantage of that. So you'll have tonight only to do this. What you have to do is you go to our website, which is lifealignedwellness.com. So I'll type it in the message here so that you have that to everyone. That way everybody can see it and click on it if they need to, or copy paste it. So go to our website, lifealignedwellness.com. And then once you're there, you're going to click on the button on the top right corner called Schedule Appointment. So you'll hover over it, it'll change colors. So you just click on that button. And then you're going to scroll down and you're going to select either in-person or virtual stem cell consultation. Those are the last two appointment types on that list. The first two are chiropractic, the second two are DNA-based weight loss, and the second two are stem cells. So make sure you scroll down and select either in-person or virtual, right? And then once you do that, you're going to come to another screen that will actually show the appointments available. And you'll have to select the day and the time that you'd like, right? And here's the key, is if you don't enter the coupon code webinar, right? All capitals, right? You'll have to pay for the appointment. But as long as you put in the code webinar, it will actually discount the consultation, so you won't have to pay anything for it. That code is going to be good for tonight only. Okay? So if you want to take advantage of it, you have to go to the website tonight. You have to hit schedule appointment. You have to select the type of appointment that you want, select the day and the time that you want, and you have to enter the code webinar in there. And that will trigger an email that we'll get. I'll see that you have entered the code. I'll see the timestamp that you sent it. And what we'll do is you'll actually receive an email tomorrow with all of your appointment details and intake forms and all this kind of stuff. We'll probably be requesting if you have images and all that. We'll get all that taken care of so that by the time your consultation time comes, you'll be able to get all the information that you'll need. Now, until then, here's your assignment. What I would suggest is you start reducing caffeine in your diet and start reducing processed sugars in your diet. So what we found is that caffeine can be inflammatory for some people, and processed sugars are definitely inflammatory. So what we want to do is start to put your body in a position where it's going to heal the best it possibly can. And those are two things that you can start to do already. So, so reduce caffeine and start to reduce processed sugar or processed foods, right? So grains and pasta and bread and stuff like that, all right? All right, so any questions? So what you can do is you can type in the chat box if you've got any questions. And I'm happy to answer those. We'll stick around just for a minute or two, and you can type it in there, and we'll happily discuss if you've got any questions. So we have a few appointments tomorrow. We just recently had a couple people that were injected for knees that we spoke with last week, and they are already doing fantastic, noticing some of the wonderful improvements. One gentleman is one of the worst pair of knees, bilateral knees that I've ever seen. And he's 2 weeks out from his injection, and he's already starting to feel better, which is pretty spectacular. Now, that's a little uncommon, but nonetheless, he's feeling and he's moving better. So that's pretty fantastic. So, All right, well, we'll go ahead and wrap up. So thank you so much for your time and attention. Make sure that you go to the website if you want to take advantage of that. And again, the coupon code is webinar. It's all capitals, webinar. And that will make sure that you have the opportunity to take advantage of that complimentary consultation and all the follow-up appointments that go with it. So there'd be no additional charge at all. All right, thank you so much. Have a great evening, and look forward to seeing you in the office soon. Have a great night.